Good afternoon and welcome to the Global Justice Center's talks that occur most Mondays. Please help us out if you can with our small staff by making a donation, which you can do online at globaljusticecenter.org. And at that location, you can also see the schedule for our talks and also listen to recordings of talks that have already occurred. For those of you who are here in person, we suggest a donation of 50 pesos if you can. Today, we are very proud to present Rebecca Grant, who is an award-winning author who has just released her new book, Access: Inside the Abortion Underground and the 60-Year Battle for Reproductive Freedom. Access charts the reproductive freedom movement from the days before Roe through the seismic impact of Dobbs. The stories in Access span 4 continents, tracing strategies across generations and borders. Grant centers those activists who have been engaged in direct action to help people get the abortions they need. Their efforts involve no small measure of daring do, spycraft, sea adventures, close calls, undercover operations, smugglings, sequins, legal dramas, victories, defeats, and above all, a deeply held conviction that all of the risks are worth it for the cause. Post-Dobbs, activist groups have once again stepped up and put themselves on the line to resist. Building on the work of their feminist forebears and international allies, they are charting new pathways for access in the face of unprecedented acts to subjugate and control half of America's population. Working above ground, underground, and in legal gray areas, they've helped people travel across state lines for care, established telehealth practices, and formed community networks to distribute pills for free to people who needed them. Access celebrates the bravery, ingenuity, and determination of women across decades who have fought for a fundamental human right and serves as an inspiring rallying cry for the work that lies ahead. Rebecca Grant is a freelance journalist based in Portland, Oregon, who covers reproductive rights, health, and justice. Her work has appeared in NPR, New York Magazine, The Atlantic, Vice, The Nation, The Washington Post, Mother Jones, Marie Claire, Cosmopolitan's HuffPost, and The Guardian, among other publications. She is also the author of Birth, 3 Mothers, 9 Months, and Pregnancy in America. So please welcome Rebecca Grant.
Hi, thank you so much for having me. I'm really excited to be here and to be speaking with you all today about the book and a little bit more about my work. And yes, thank you, Gregory, for that introduction. So I'm just going to start briefly by talking about how I got on this beat and kind of how I think in some ways that informed the book and the scope, because as you just heard, the book talks about feminist movements, abortion activism across generations and borders. And so I really did cover a lot of ground. So I've been a journalist covering this beat since 2015. And I really started on this beat right when I started freelancing full time, because that was this moment when I realized I could report and cover anything that I wanted to. And when I was first thinking about becoming a kind of a beat reporter, really focusing on this in a really deliberate way, I was talking with some editors or some kind of journalistic colleagues or people who were further along in my career. And a piece of feedback that I heard from a couple of them, mostly men, was that they didn't think there was enough of a beat there. They didn't think that there was enough news, enough urgency, enough interest, enough ongoing relevance to be able to kind of dedicate so much coverage to the topic. And I really felt like that was not true. I felt like what I was seeing, even in the news or in local media or from kind of my early days connecting with sources, that it seemed like there was this wave of anti-abortion laws, of anti-abortion restrictions that were affecting people in these really profound ways, and that it wasn't really being treated like the crisis that it seemed to me to be, and that it seems like we are on this path which could ultimately lead to the overturning of Roe. And so I think that maybe at the time, 2015, that wasn't necessarily treated as a super mainstream point of view. But then, of course, in November of 2016, Donald Trump was elected president. And for the first time, I think there was this widespread, more mainstream fear about the fate of reproductive rights, the fate of abortion access in America. And so it was, even though it was very stressful in many ways, it was also a really good time to have positioned myself on this beat. So I've been reporting on these issues for a decade at this point and covered lots of different stories over the years. I mean, so many stories of laws that were being passed that were really extreme or just kind of wacky and just the example that I often will cite is there was a law that passed in Texas in 2017 that mandated funerals for fetuses. And so I was calling like funeral parlors in Texas to ask if they were prepared to handle this kind of thing, and they weren't. And one of the things about covering so many laws like that, or talking with people about the really hard experiences that they went through, or talking with clinics and providers who worked at clinics about how embattled they were and how many protesters that they attracted all the time, how challenging it was to run financially to run a practice, especially when you were serving clients who couldn't afford to pay full price. And so, I, in addition to focusing on the bad things, the negative things, the hard things, I also started to pay a lot more attention or dedicate a lot of my reporting energy to what activists were doing, to what people were doing that felt like it was proactive, that felt like it was going on the offense in order to shore up and protect and expand access. And I think that was important both, I mean, just for my own interest in kind of, mental health, wanting to report on things that felt like they were positive in addition to all of the hard things. But I also felt like that was sort of this undercovered area of focus from a media perspective. I mean, there was so much conversation about politics and the courts and the major organizations, which do really important work, but they also take up so much of the space in the conversation about reproductive rights, right? So like organizations like Planned Parenthood or NARAL, which again are really important, but there was so much more going on in the landscape that it felt like needed or deserved more attention than they were getting. And so I started reporting kind of a lot on these activist movements. And in 2022, in the lead up to the Dobbs decision, so it was, I believe, March or April 2022, I got an assignment from New York Magazine to kind of do this almost like not hypothetical piece, but just to look at how would people be able to access abortion pills in the event that the worst happened, in the event that the Supreme Court, in its upcoming decision, decided to overturn Roe versus Wade. And so some of the article looked at the kind of places that were really well known at that point. So there was an organization called Aid Access, which I will talk about in a little bit in more detail a little bit further in the talk. But one of the things that my editor asked me was, do you think you could find a source? Do you think you could find someone who's planning to distribute abortion pills unofficially, underground, kind of outside of FDA approved channels, who is really preparing for the fall of Roe by thinking about, an entirely alternative ecosystem to the clinic-based model that has dominated in the US since Roe, since 1973, or really before that. And so I honestly wasn't sure at the time if I was going to be able to find a source who A, was doing that work, but then B, was willing to talk to me about it. But that was one of the reasons why I think, having been on this beat for so long, having focused on activists and told their stories as I had been over, I guess at that point, the past 7 years, I was well positioned, better positioned, I think, than probably a lot of the other reporters who covered something generally along these lines to be able to find the right people, ask the right people if they knew someone, and get them to talk to me. And so there was a source who in the book I referred to as Stephanie, and she agreed to speak with me, which frankly I remain shocked by, but she agreed to speak with me. And so we did a phone call where she just told me about how she had gotten into this type of work, and her kind of the broad strokes of her story were that she had lived abroad, she had worked abroad, not having anything to do with women's health, with reproductive rights. But when she moved back to the US around 2016, she was really riled up about the election. She really wanted to do something. And so she started getting organized, or she started organizing for Planned Parenthood and doing fundraising and volunteer work for the local Planned Parenthood affiliate where she lived. And during the course of that work, she came to learn more about other organizations that also fought for abortion access. So, abortion funds, mutual aid organizations, practical support groups who really operated in the gaps that the kind of dominant clinic based system had left, who were the organizations who said, yes, abortion might be legal, but that doesn't mean that it's accessible. There are so many people who can't get to a clinic for the reason, for so many reasons. They can't take time off of work. They don't have access to transportation. Maybe they can get to the clinic, but they can't afford the cost of the procedure and their insurance doesn't cover it. And so through that exposure, she got more involved in organizing kind of in a grassroots way with helping people if they needed a ride to a clinic, if they needed support with childcare during their appointment, kind of organizing people in her community to help with that. So she did that for a few years. And then in 2020, of course, the pandemic broke out. And all of a sudden, the many, many strategies, the many kind of tools that her group had to help people get to clinics, those were no longer effective because those clinics had closed, in many cases suddenly overnight. So there was a young woman that she knew who was a college student in a nearby state who had made an appointment for an abortion in Stephanie's state. And she had driven hours to get to that clinic. And when she arrived there, the clinic was closed. And they hadn't notified their patients. They hadn't notified folks like Stephanie who were helping the patients maybe with getting there, that they were closing because the legal landscape, the regulatory landscape was shifting so rapidly. And so in many cases, clinics, basically had to close overnight. So there was this situation in which there was really no way, helping someone with a ride wasn't going to help if the clinic was closed. And so Stephanie took that as the opportunity to do something that she had been wanting to do for a while, which was to mail the young woman abortion pills and help her kind of facilitate her in self-managing her abortion outside of the clinic environment. And Stephanie did this. Everything went smoothly. It went okay. And then after she told the other members of her group, she said, listen, I just did this. I think we should be doing this more. It doesn't have to be in some sort of an official capacity, and really it shouldn't be because it's not technically legal, or at least it's in a legal gray area. But I just think that this needs to be an option for people who we can't help any other way. And so she kind of slowly built up this network. At first she was sourcing the medication. Some of it she would get from Aid Access, which is the organization I mentioned before. She had a local doula contact who had a supply of misoprostol, which is one of the two drugs that's used as part of medication abortion. And then when Dobbs happened, all of a sudden she was like, we need to scale up. We need to make sure that people, not just in our community, but across our state, across our region, across the country, also have access to medication mailed outside of these official regulatory legal channels for free. And as part of her scaling up her network, she needed a steady, consistent supply of the medication. The doula strategy was okay for a small scale, but because there's the two drugs that are used as part of the medication abortion regimen, there's mifepristone and misoprostol, and really using the combined regimen is considered to be the gold standard. So she both needed access to more medication more affordably, and she wanted to find access to mifepristone. And she learned about, or she was already familiar with, but she learned about the offer from a Mexican human rights activist and abortion activist named Veronica Cruz, who was the founder of the organization Las Libres, which was founded in 2000 in Guanajuato. And Vero had basically said, I have plenty of medication. Anyone from the US who wants medication can come and pick it up for free. You have to come get it, but I won't charge you for it. And it was this incredible act of generosity, of solidarity, of really a commitment on Vero's part to helping the activists in the US as they figured out, what do we do in this weird, wild new world that we're living in? And so in 2022, one of Stephanie's contacts, one of the people she had been working with, flew down to Mexico, and she met with Vero in a Starbucks in San Miguel de Allende. And that contact hadn't been sure if she was going to bring pills back with her. She was nervous. She had never done anything like this before, but Vero had spoken so passionately and with so much conviction that she really sold this woman. And she took the pills and she brought them back to the US, and everything went off without a hitch. And that was sort of the seed of a network that really would grow and grow and grow, and has continued to grow over the past couple years. And so I think that there were a few things about that particular interaction, that particular exchange, that really encapsulate some of the larger trends that I have observed, that I have documented over the past couple years. And one of them, as I mentioned before, is the sense of solidarity. But it's really these activists like Vero who had been operating in many cases in the global south, but also in criminalized contexts for decades. And so they knew better than anyone, frankly, in the US, how you enable abortion access in a safe and effective way when you're operating in an environment with abortion bans or where abortion is criminalized. And so really the activists in the US were having to look abroad. They were having to look to their counterparts who were working in other countries for guidance, expertise, insight, infrastructure, I mean, all of it. And those activists, those international activists, really stepped up to help. So to back up a little bit, I'll just talk some about the founding of Las Libres and a little bit more about Vero's work and kind of how she got to where she is. So she has a human rights and community organizing background. And around the year 2000, kind of in the lead up to that, she had been involved in some of the UN efforts around promoting gender equality, and she was involved with with the Mexican group that was kind of sending their delegation to some of these UN conferences. And so she was well connected within the feminist community, and her work hadn't explicitly focused on abortion, but certainly reproductive rights and women's health and gender equality were all part of things that she worked on. And then in the year 2000, in the state of Guanajuato, the legislature was debating and moving towards removing the rape exception from the state's abortion ban. And so Vero, along with another local group of feminist activists, they came together, and they were one of the groups, they were participants in the effort to organize against that law. So there were big street protests, there was this big outcry, and there was the sense that if the state of Guanajuato was able to remove that exception, that it was sort of like a trial balloon, and that other states would follow in their footsteps. So certainly the kind of fate of this law was really important and urgent and relevant for the state of Guanajuato, but it was also felt like this sort of national issue. So it really got a lot of attention. And Vero, as she always seems to do, she prevailed. And their effort to have the law remain as it was, to maintain the rape exception, they succeeded, and the legislature didn't move forward with it. From there, Vero thought, well, okay, we fought to preserve this exception, but what good is this exception if people can't access abortion, right? They might have the right to do it, but that doesn't mean anything if they don't know where to go or if nobody will help them. So she found a local OBGYN who was willing to provide abortion care to the people who came Vero's way. And after, I think, just a couple months, that OB-GYN went to an international conference where she learned about medication abortion. Now, in Mexico, the second of those two medications I spoke about before, misoprostol, is available in pharmacies over the counter as an ulcer medication. And so Vero's idea was, well, it's not that hard to administer the pills. You really just have to evaluate someone for their eligibility, and then you have to explain to them how to properly use the pills, what the protocol is, and then you have to give them the support that they need, whether that's emotional support, whether it's a place to safely take the medication. And so part of Vero's idea was that people could access the medication by the medication pharmacies, and they didn't need, the boxes came with 28 tablets, but most people for their abortion would only need 12 to 16. So they could then pass the extra pills on to the next person. But in addition to giving them the medication, they could also provide that emotional support. They could explain that process. And because it was someone who had done it themselves, the current person who was self-managing their abortion, they wouldn't feel judged. They would be talking with someone who had already been through the process, so they knew that they would be okay. And it really created this peer-to-peer solidarity-based network that lent itself really easily and quickly to spreading. And this model became known as accompaniment. And over the years, it has spread all over Mexico and really throughout Latin America. So in 2009, which was a few years after, Vero had kind of first started this accompaniment model, she attended a conference in Latin America where she learned about another model for enabling abortion access in a criminalized context with pills in a safe and effective way. And that model doesn't kind of have an official name in the same way that accompaniment does, but it's most commonly referred to, or I know it as, safe abortion hotlines. Now, that model, the origins were with this organization that was launched also in 2000 by a Dutch doctor called Women on Waves. That doctor, Rebecca Gompertz, she had been a doctor, a physician aboard Greenpeace ships with some of their campaigns that they did sailing around the world to protest environmental degradation. And she had this idea of, could you apply something similar, but to abortion care? And in international waters, maritime law states that the laws that apply are that of the country that the ship is flagged to rather than the country that it might be closest to. And so Rebecca Gompertz's idea, Dr. Gompertz's idea was, okay, if you sail a ship to international waters with a boat flagged to the Netherlands, you could legally provide abortion care at sea. And so she built up this organization called Women in Waves that did just that. They did these boat campaigns. And their first campaign in 2001 was to Ireland. They did not actually provide abortion care on that trip because of some regulatory squabbling, because it was really important to Dr. Gompertz that everything that they do be legal. They were exploiting loopholes in the law, but she wanted to make sure that everything was legal. That was sort of the power of the point that she was trying to make. The second campaign in 2003, they sailed to Poland and they were successful. They helped provide medication abortion to over a dozen women in Poland, which continues to have some of the strictest abortion laws in Europe. And then in 2004, when Women on Waves went to Portugal, they were blocked by the Portuguese Navy. Their boat wasn't even allowed to dock at the harbor, at the port where they had reserved a berth ahead of time. And there were literal naval warships who went out there to stop them. And so in lieu of being able to directly dispense the medication, Dr. Gompertz went on Portuguese television and she explained on air that local women could go into pharmacies, they could buy misoprostol, which in Europe, I believe, went under the brand name Arthotec, but it's most commonly known as Cytotec in Latin America. But they could go into the pharmacies and this is how they could take the pills and this is what they could expect. And it was kind of the first time that someone in a really public way had put this information out there. And that was pretty revolutionary. I mean, there had been cases of women who had figured this out on their own and distributed that information by word of mouth. In Brazil, there's the story about women in one of the country's kind of poorer regions in the Northeast who realized that misoprostol, that the medication had a warning on it that said, don't take if pregnant, could cause miscarriage. And they thought, oh, that's interesting. So there had been plenty of examples of this information spreading through word of mouth, but going on a TV show, airing it in public was really kind of a watershed moment. So in the next campaign that Women on Waves did a few years later in 2008, they were in Ecuador. And in Ecuador, they had all of these issues with their boat itself. It got caught in a storm, it wasn't able to sail. And so instead, they just did the hotline. They just put this big banner that they hung from a statue that kind of sits on a hill above Quito. And so you can really see it from almost all over the city. They hung this banner that had the hotline number, and the sign said, you know, safe and effective abortion, basically call here. And they set up a hotline that women could call. And then the people who answered the phone would explain to them, this is what you can do, this is where you can go. And so both the accompaniment model and the safe abortion hotline model were proliferating around Latin America kind of in the decade that followed. And it was both, you know, these models were both this way of direct action, this model of direct action in which the activists involved were providing people who needed abortions with abortion care. They were helping them access the kind of the detailed information that they needed, the mechanisms for how to source the pills, but it also functioned on this other level, which an academic, this isn't my term, but an academic has coined transformative illegality. And it's this idea that these models that kind of subvert abortion laws and enable people to easily maneuver around them are undermining the law. They also function as a tool of resistance. And that has proved to be really powerful, even in a legal way. And so there's a couple of examples. I think Argentina is a really, really great one. Ireland also is, where when the countries, when the governments, the legislatures, the presidents, when they were trying to decide what to do with their abortion laws, if they were thinking about reform, if they were thinking about repeal, if they're thinking about legalization or decriminalization, whatever kind of this exact legal question was, or political question was. And the example of these activists who were circulating the pills were used as part of an argument for why it should be legal. In some cases, it was this idea of like, well, if we know that people are accessing these pills and we know that it's safe, like, what's the point of having these bans? They're not really doing anything. The other thing that was so kind of radical and revolutionary about abortion pills was that it decoupled illegality from safety. Because, you know, in the US pre-Roe, there was a lot of talk of coat hanger abortions or back alleys, and it was really scary. I mean, you know, there were so many complications from illegal abortions that hospitals had wards dedicated to serving those patients that were known as affected OB. So for a long time, really before the advent of medication abortion, the idea that an illegal abortion was also unsafe was, you know, those things went together. But the pills really separated them. And so that meant that countries where abortion was legal, it might not be accessible, as was increasingly the case in the US. And it also meant that in countries where abortion was illegal, that didn't necessarily mean that it wasn't accessible. And that was this really kind of interesting moment that I will now take us back to the US, where we had this case where, you know, let's say around this time before the Dobbs decision, abortion was legal nationally, but it was increasingly inaccessible to so many people. And part of that was because in the US, medication abortion and mifepristone specifically were so tightly regulated that accessing the pills was really no more accessible than going to a clinic to have a procedure, because people still had to go to the clinic to access the pills. So all of the same barriers that were involved with going to a clinic, with getting to a clinic, those barriers I talked about before, transportation, money, childcare, all of those things, it was just as true for a procedural abortion as it was for the medication. Well, that really changed during COVID, because during COVID, the FDA revised its regulations about mifepristone and said that instead of it only being accessible in a brick and mortar clinic, it could be mailed. It could be prescribed via telemedicine, and it could be mailed to mailed to patients in packages to take the medication at home. And so, you know, that was a battle, making mifepristone, making medication abortion available via telemedicine, available in the mail, that there had been activists and public health officials fighting for in the US for years, but it was really COVID that catalyzed that change, that precipitated that change. So In 2018, Dr. Gompertz, the physician who started Women on Waves, she launched an organization in the US called Aid Access, which was basically a telemedicine abortion service. When Dr. Gompertz launched it in 2018, this was before COVID. This was before telemedicine abortion was legal. So she operated on an international telehealth model, which was that she would be the prescribing physician registered in Europe, and the pills that she prescribed were dispatched from a pharmacy in India. And so there was no Americans who were involved in aid access until the telemedicine laws changed in the US, and she was able to start working with American providers who could legally prescribe the medication via telemedicine. And so when Dobbs happened in 2022, there were these kind of two types of these two models. One of them was the telehealth model, which had really been pioneered and developed in the US in many ways by Dr. Gompertz, who was European, but who had spent her whole career kind of fighting for for better access on an international scale to abortion. And you had the safe abortion hotlines and the accompaniment networks throughout Latin America. And so both Dr. Gompertz and Vero, when Dobbs was imminent and in the immediate aftermath, they stepped up and they said, we will do what we can. We will help the Americans. We think it's ultimately important that these channels for access are in American hands, but that we will help you get there. And so Aid Access, they are certainly embattled right now, and they're facing a number of lawsuits to shut them down. But they have provided, I believe it's over 100,000 abortions, or they've sent out 100,000 packages to people in the years since Dobbs. And they are probably the leading provider of abortion in states that have abortion bans. And then the networks that Vero really helped seed are what are known as community support networks. I will sort of casually refer to them as underground networks because I think that underground is sort of a shorthand for the way that they access on the margin, or the way that they operate on the margins of the law. But underground can come with some kind of unsavory connotations. And so that's why they prefer to refer to themselves as community support networks. But they're really more in the vein of what Vero had built with accompaniment or safe abortion hotlines, which is that anyone can reach out to them, answer a couple of basic questions for eligibility, and then if everything kind of is above board, then they will receive a package with medication abortion in the mail that they can self-manage. And these networks often will have people who can help them, who can provide that accompaniment that was so central to Las Libres and what Vero built, which is that they can provide emotional support, they can help answer questions if need be. And so as a result of this is not to say that the Dobbs decision hasn't been catastrophic, that it hasn't meant that there are so many people who are unable to access abortion across the country. It's also not to say that taking abortion pills, that self-managing abortion is a good fit for everyone. It's certainly not. I mean, everybody deserves access to clinic-based care if that's what's best for them. If there's people who have certain contraindications, certain potential complications or conditions, medication abortion might not be a good fit for them. If there's someone who doesn't have easy access to the internet or a safe and stable home environment, they might not have a place to order the pills, receive the pills, take the pills. So there's all kinds of reasons why these types of networks, why telemedicine, why community support networks are not some sort of like a silver bullet or a penny. They're not solving all of the problems that Dobbs has created, but they're certainly a really important pathway, a really important channel for access that I think it's fair to say have offset some of the damage of the Dobbs decision. And it really, again, as I spoke about before with transformative illegality, I think it's this idea that these types of networks are both helping people access abortion in a direct way, and they're also providing this really powerful kind of message and ethos of resistance, which is to say, we don't believe the government has any right or role in dictating the decisions that people make about their own bodies. And so we're just going to do whatever we can to make sure that that doesn't happen. And so I think it's also a story of that form of resistance, and one of this international connection between activists who live in very different parts of the world, who come from really different contexts, but have been able to adapt some of these models to work best for them and their communities. And so, the Americans who launched accompaniment networks in the US, what they're doing looks a little different from the way that most of the accompaniment networks operate in Mexico, because one of my sources kind of referred to it as being very gringo about it. Like, they adapted it so that it would work better for them. And I think that that is a story, I hope, of optimism. It's a story that is not, it's not a story of defeat. It's a story of resilience and courage and ingenuity. And so even though the landscape for abortion rights has been pretty bleak over the past few years, there is, I think, another story there. And that was the one that I really tried to tell in the book. So thank you for listening. I will stop there now, and I'm happy to take questions. I'll take a sip of water. But yeah, that is everything that I wanted to speak about today.
Thank you so much, Rebecca. There's so much important information here, and I hope there'll be some good questions from our online and physical audience. Anybody online or that we can see who has a question at the moment? If not, at this moment, if you don't mind, I'm going to make some comments for you to address. In the United States especially, but of course in other countries, the legal issues surrounding abortion and reproductive care in general often overtake the political and ethical questions. Obviously, we can't separate the legal from the political, but it seems to just take up so much space, so much time, as well as so much money. And people sometimes are talking about, for my mind, too much about legal issues, which I know they have to, but they don't get into all of the important issues regarding reproductive care and the role of women in general.
Mm-hmm. Yeah, I think what you're getting at right there is something that I think about as a rights-based framework versus an access-based one. And so, the rights-based framework, and even when we use the term reproductive rights or we talk about reproductive rights, that's really focusing on the legal issues, right? That's thinking about rights as recognized or upheld by the courts. And as I think I mentioned when I was speaking, that's actually a fundamentally different question from how accessible abortion is, right? And so a thing that a lot of activists said to me after Dobbs was that, abortion was pretty inaccessible in our state even before this decision. So the clinic at the center of the Dobbs decision, Jackson Women's Health Organization, was the only clinic left in Mississippi when that decision happened. And so, right, like that means that for people who lived in Mississippi, abortion was still pretty inaccessible, all things considered. And there's all these other factors, right? Like the Hyde Amendment, which means that that federal Medicaid dollars can't go towards abortion, which makes it much more inaccessible for poor people. And so I think that there have been activists in the US who frankly, decades, but certainly I think over the past.
Say less. If you want to press it.
Over the past 10 years have.
Is there someone who wants to make a comment who's online? Could they introduce themselves? No?
Yeah, Rebecca, can you hear me?
Yes.
If not, I haven't. Do you have a question? Someone who's online?
Yeah, Rebecca, is there any viable court things that we can do to attack Dobbs, like marginalized groups, equal access? I don't know. What are your, and I missed the first part, so you may have addressed some of that.
Excuse me. Yeah, sorry, one sec. I think from my reporting, a thing that I have really come to see is that you need people who are doing the legal fight. You need people who are doing the political fight. You need lawyers who are filing those cases. You need advocates who are lobbying at the state, local and federal level, all of that has to happen and is important. At the same time, I don't think that that can be the only front, I guess you could say, in the fight. I think that all of those kind of access-based things that I was talking about before that might not actually be about the courts, but are kind of about helping people access abortion or reproductive health care in general in the moment, that also is important. And so within the movement, within the repro movement, kind of writ large, in the US at least, there have been these tensions over the years between the activists who are really focused on legality and the courts and rights and all of that, and the activists who are like, that's not actually helping people in the moment, or that can't be the only kind of avenue of the fight. And so we're going to do these things on a more grassroots level, whether that looks like mailing people abortion pills, or it looks like, operating a practical support fund that pays for people's hotel rooms or something if they travel for care. So I think that a thing that we've seen, and that I think has been precipitated by the Dobbs decision, is this idea that focusing on legal issues, on the courts, on politics is not enough on its own. Because ultimately what that does is it puts the fate of access to reproductive health care in other people's hands. It outsources it. It kind of says, this is up to the judges, this is up to the politicians. And I think for the activists who think that it shouldn't be up to anyone but the individual, they think it's important to also have these kind of ways to access reproductive health care that aren't reliant on what happens in politics and the court. So I think you need both. And I think that it's hard to have both. And like I said, there can be tensions over strategy. There can be tensions between the radical outsiders and the institutionalists. There can be tensions between people who are really uncomfortable with illegal activity and those who think that illegal activity is necessary to uphold human rights. I mean, a lot of those dynamics can be really challenging to navigate and have been. But ultimately, I think that kind of the movement and the cause is stronger when you have people who are working on both those fronts or on all of those fronts, because they do think that they complement each other.
I have a comment, unless there's someone else online who has a comment or here. In the back.
Thank you for a very enlightening talk and your journalistic energy, which is so lacking in the Western world these days. In Mexico, within days of the overturning of Roe versus Wade, the Supreme Court weighed in the opposite direction. And yet here, there are states where, given whatever party is controlling the state, the federal mandates are not being met, and access is difficult. And I'm wondering if that is a situation that exists in a lot of countries.
Mm. Yeah, I think so. I mean, I think that, and I mean, to that point, that was one of the reasons why for Vero, whose work really focuses in Mexico, even after the Mexican Supreme Court made its decision decriminalizing abortion and certain states, changed or reformed their laws, that she was emphatic that her accompaniment model, which kind of operates outside of those channels, that it had to remain in place, right? That like the court decision or the Supreme Court decision didn't in any way offset or reduce the necessity for the type of work that she did. And I think that that was kind of a mistake in a way that we made in the US back in the 70s, which was that there was all of this energy, which I didn't speak about today, but I do address in part one of my book. But that a lot of the underground kind of activist energy that was really robust before Roe and which kind of contributed to the environment that led to that decision, it kind of disappeared after Roe because there was all of this excitement, understandably, justifiably so, about being able to have this legal clinic-based system. But ultimately, what having this clinic-based system did, like I was just speaking about with John's question, was that it gave the permission infrastructure away, right? It meant that it was the people's ability to access reproductive care was subject to other people. And so I think that kind of part of what Vero has said, both in Mexico, but internationally, I think also part of what Dr. Gompertz will say or other activists is that it's always risky to completely rely on any kind of an establishment or institutions to protect access to abortion, and that it's important that in addition to these kind of legal based channels, it's important that there are also these alternative ones. And so I think that, certainly I think Mexico, Ireland, Argentina, some of the countries that I mentioned in the course of the talk are the ones that I'm the most familiar with. But I do know just anecdotally that there are certainly plenty of countries around the world where access is not, even if it's legal, that doesn't necessarily mean it's accessible. And that could be because of a state by state patchwork, like you were talking about in Mexico, or it could be, there's other reasons for that too, right? It could be an affordability thing. It could be that there's a lot of barriers. So one kind of example, I guess, that comes to mind is in India, where I also did a bunch of reporting for the book, which is that abortion and medication abortion early, in the first trimester is legal, but that women have to get the approval of at least one doctor in order to access the medication. And so particularly for women who live in rural or small communities, that doesn't mean that there's not this huge stigma there, or that if they were to go to the doctor to try to access this kind of care, or if they were to go into a pharmacy and buy the medication, that word wouldn't get around, and that the stigma wouldn't also really affect their capacity to access it. And so, I'm sort of rambling a little bit, I guess, but I think that I think it just kind of gets to this point of whatever the legal situation is. I think pretty much across the board, there's all of these other things that still affect whether people are able to access care and how they are and what the specific barriers might be, even if those barriers certainly vary from place to place.
I understand that in the United States, fewer medical students are choosing obstetrics and gynecology as a field of study and practice. I suppose partly due to fear, partly due to financial reasons, and that, of course, down the line is going to have an effect as well on everything that you're bringing up.
Yeah, absolutely. And that's something that I think is maybe underappreciated or under discussed as what will ultimately lead to a much bigger crisis. And so we both have information, data that states that have passed really strict abortion bans. I think Idaho is the one that I'm the most familiar with, but they have seen a mass exodus of OBGYNs from their state. And so that's not referencing students, but for the kind of the field in general, I think the statistic that I included in the book, I don't know if there's a more recent one, is that 1 in 5 OBGYNs have left Idaho. And so that is adding on top of what was already a crisis before Dobbs, which is both of maternal health care and maternal mortality, which is something I spoke a lot, or I wrote a lot about in my first book, but also in the kind of crumbling, the dissolution of rural healthcare infrastructure in the US. And so really separate from Dobbs, there's already this problem, particularly in rural parts of the US, where hospitals are closing locations or they're closing down their labor and delivery wards, they're consolidating. And so there's just fewer, people have to drive much, much farther to give birth or to access maternal health care. And so that, when you're adding that on top of Dobbs, and then you have the lack of students or the decreased number of students who are trying to go into this field. I think that's so important to understand is that abortion care is maternal health care. We already know that maternal mortality and infant mortality have gone up because of Dobbs, because abortion care is miscarriage management. There are so many reasons why people might have complications during their pregnancies that the thing that will save their life is, even if you don't want to call it that, it is abortion care. And so if there are fewer students, if there are fewer physicians, nurses, doctors who have these skills, that also means that it's going to affect the health and well-being of people who want to carry their pregnancies to term, people who are not choosing abortion, people who are hoping to give birth and have a healthy baby, but that's not in the cards for them. And there are plenty of examples of this. There was a couple cases in Texas. There was a lawsuit that ended up having around 24 plaintiffs, and it was all women who were carrying wanted pregnancies who had life-threatening complications, and they were unable to get the care that they needed in a timely manner because the doctors were not able or willing to provide their care, even though that state, you know, in that case, Texas, ostensibly has a law on the books that says you can provide an abortion if it threatens the life of the mother. But doctors have said again and again that in practice, they have no idea where that line is. Like, how close to death does someone have to be before you can intervene? And if you do intervene, are you going to be prosecuted? And so I think that all of these things together, including a smaller supply chain, a smaller kind of pipeline rather of students who are equipped to provide this kind of care, is in the not too distant future going to create an even more acute maternal health crisis. And that's, again, on top of one that, like, the US is one of the only countries in the kind of developed industrialized world where our maternal mortality rates have been going up. And we have some of the worst maternal mortality rates compared to peer countries. So it's already pretty dire. So yeah, I mean, I think that's definitely the doom and gloom answer, but it's certainly something that I'm worried about because I think it's going to be one of those things that it's going to take so long to repair, and so many people are going to be, harmed and not able to access the care that they need along the way.
And even if you don't speak about maternal health care, but about so many women who suffer from endometriosis and how the pain that goes with it and everything, and you don't have doctors who are trained to recognize it, treat it, and of course there's a lot of misogyny that goes with not recognizing it. These become problems which are just magnified by our American Taliban.
Oh, I saw there was another question in the chat. Hold on, just pulling it up. Oh, there we go. Oh, so yeah, this question in the chat is about the Christian right and sort of their advocacy. And yes, I think that's fair to say. Many of the individual figures or the politicians or the organizations who are driving a lot of this, I think, have pretty strong Christian right connections, whether it's through Project 2025, or there's a particular man named Jonathan Mitchell, who is formerly a Solicitor General in Texas, who is a figure who is behind so many of the lawsuits that they're trying to do so many things, whether trying to get the FDA to remove its approval or rescind, kind of pare back its approval of mifepristone, or he's very actively right now going after Shield Law providers and the ability of Shield laws to protect them, which I didn't really talk about, but I'll just really quickly for those who don't know, Shield laws are laws that a series of blue states have passed in the wake of Dobbs, which say that if they have a physician or a nurse, a certified kind of prescriber of medication abortion who lives in their state, let's say Connecticut, Massachusetts, California, New York, and they're prescribing medication via telemedicine to someone in Texas, Alabama, Louisiana, that the Shield state, the blue state, will protect that clinician. And so that's basically why these American doctors have been able to prescribe medication abortion at such a large scale to people all over the country over the past couple of years. So the main kind of network for this is Aid Access, which I talked about, which was founded by Dr. Gompertz. And so because in the wake of Dobbs, they have, any effort to shut down Shield laws and Shield law providers has not been successful. That's really one of, I think, the primary targets right now, is to challenge Shield laws. And I think, Jonathan Mitchell, who is a member of the Christian right, who's a very kind of religious conservative person, and he's really kind of the chief engineer of that. They're ultimately hoping to get this up to the Supreme Court. So, there are organizations who would not necessarily identify as being on the Christian right that are anti-abortion, who are doing activist work, but so there's certainly exceptions to that, I think, but for the most part, yeah, it's the Christian right.
I don't believe we have any other questions or comments at this moment. So, Rebecca, again, thank you so much for all of this really important information, and hope that many people out there will read your book and hear your talks and be inspired to help in the struggle for reproductive justice. So again, thank you so much.
Great. Thank you so much for having me. Appreciate the questions.
It was a pleasure.